Now the spleen. Here we can see this organ is the spleen, and it is a wedge-shaped organ, and it is situated between the fundus of the stomach and the diaphragm. And it is in the left hypochondriac region, and it is related with 9th, 10th, and 11th ribs. The spleen has some interesting features. That it follow a odd number, that means 1, 3, 5, 9, 5, 7, 9, 11. Here you see this is the thickness of the spleen, and this thickness of spleen is 1 inch, and here is the breadth of the spleen. The spleen is 3 inches in width, and it is 5 inches in its length, and it has a weight of 7 ounces, and it is related with 9 to 11 ribs. So all the numbers, odd numbers 1, 3, 5, 7, 9 and 11, these are related with the spleen, and this is the Harris dictum, and it is its long axis is related with the 10th rib. In the spleen, it has some features, that it has 2 ends or 2 extremities. Here is the posterior extremities, or in this body we can see this is the posterior part and this is the anterior part, and it is the medial and it is the lateral. So this is the posterior extremity or the medial end. Here is the anterior end or the lateral end or the anterior extremity. It has 2 surfaces. This is the diaphragmatic surface. Here is the diaphragmatic surface, and this part is visceral surface. This is the visceral surface. And this 2 borders. Here you see there is the superior border, and it is nosed border in this anterior end. There is nose. And this is the posterior border, and it has 2 angles. Here is the posterior basal angle. This is the posterior basal angle. It is related with the posterior border and the anterior end. This is the posterior basal. This is the anterior basal angle. These are the angles. And here you see this is the visceral surface. And is in body we can see this is the visceral surface. It is related with the fundus. It is the cut end of the stomach, and it is the stomach. So this is the gastric impression. Here is related with the colon. So this is the here you can see this is the this part is here. This is the colic impression, and here you can see there is the kidney, and this is left kidney, and there is a impression. This is the known as the renal impression, and this part is the hilum. This part is the hilum. Sometimes it is known as the intermediate border. And hilum, we see there are the vessels that enter into the spleen. This spleen is situated in the left hypochondrium, and the hilum is related with the tail of the pancreas. Here you can see there is the tail. Ligaments of the spleen. Here we see there is a ligament that connects the stomach with the spleen. This is known as the gastrosplenic ligament. And there is another ligament that connects the spleen with the kidney. This is the linorenal ligament. Here we see the cross section through the hilum of the spleen. This is the spleen, this is the stomach, this is the left kidney. So here we see this is the lesser sac, and this is the part of the greater sac. Here we see a fold of the peritoneum, it is the fold of the greater sac, and this is the fold of lesser sac. And this is connecting the spleen with the stomach, and this is the hilum. Here is the tail of the pancreas, so this is the hilum of the spleen. So in the hilum of the spleen we see there is the anterior border that is formed by the greater sac, and there is the posterior border that is formed by also by the greater sac. This is the part of the greater sac. This is the greater sac, and this is the lesser sac. So we can see there is a ligament, that is the gastrosplenic ligament, and here is another ligament, that is the lino-renal ligament. Lino means the spleen and renal means kidney. The lino-renal ligament. This posterior part, this up to this is the gastrosplenic. From here we can see this is the anterior part is formed by the lesser sac and the posterior part is formed by the greater sac. In between, this ligament is known as the lino-renal ligament. Here we see that the lino-renal ligament contains the tail of the pancreas, and this is the splenic vein, and this is the kidney. So this part, posterior part, is the lino-renal ligament. In anterior part, it is the gastrosplenic ligament. This is the hilum of the spleen, blood supply of the spleen. Here we see this is the abdominal aorta, and here is the celiac trunk. From this celiac trunk there is one branch that is known as the splenic artery, and it is tortuous in nature. This splenic artery enters into the spleen and supplies this spleen. And the venous drainage of the spleen, here you see this is the splenic vein. The splenic vein returns to the liver, forming the portal vein. Here we see the splenic vein, it unites with the inferior mesenteric vein, and finally with the superior mesenteric vein it forms the portal vein. This is the splenic vein. This is venous drainage of the spleen. Now the interior of the spleen. Here we see the interior of the spleen. Here is the interior of the spleen. It is the hilum. Through this hilum, all the vessels enters into the spleen, and in the spleen, the vessels are named in different parts. Here we see the splenic vessel, the splenic artery entering into the spleen. They name as the trabecular artery. So here we can see the spleen in the section. This is the spleen. This is the capsule of the spleen. Here we can see there is the capsule of the spleen, and this capsule enters into the spleen, forming the trabecula. This is the trabecula. Here in this magnified view, we can see this is the capsule of the spleen, and in this capsule enters into the spleen, forming this trabecula. And this part we can see there is diffuse area, and this is known as the red pulp, and this area is known as the white pulp. So the splenic artery divides to form this trabecular artery. This trabecular artery, from this trabecular artery there is the central arteriole. This central arteriole, that means it remains in the center of the white pulp. This white pulp has 3 areas. This is the white pulp. In this picture, this is the white pulp. This white pulp, in magnified view we can see this is the white pulp. The areas of the white pulp are the central area. Here is the central area, and now it remain at the side. It is pushed laterally by this germinal center. This germinal center is the area where the lymphocyte, that means lymphocyte proliferate to form the germinal center, and they produce the antibodies. When this germinal center is proliferating, they enlarge and push the artery to the side. If this germinal center is inactive, they remain small, and this artery will remain in the center part. So this is known as the central arteriole. In the side of the central arteriole, we see there is the whitish area. This is known as the periarteriolar lymphatic sheath. That means pulse. Periarteriolar lymphatic sheath. And in the side there is the marginal zone. This is the marginal zone, and there is the sinuses, that is the marginal sinuses. This is the white pulp area of the spleen. And here is the artery that is known as the central arteriole. After leaving this white pulp, the arteriole enter into this red pulp area. This is the red pulp area. In this red pulp area, this arteriole give branch to form the peninsular arterioles. Here is the peninsular arterioles. These peninsular arterioles finally branch into the capillaries. Here is the capillaries. These capillaries finally terminate into the sinusoids. From the sinusoids, there is the vein. There is the red pulp veins. These red pulp veins finally drain into the trabecular vein and the splenic vein. It forms the splenic vein. Here we see some capillaries in this red pulp area are open, and some capillaries are continuous with the sinusoids. Here we see the magnified view of this area. This is the splenic sinusoid, and here is the arteriole. This is the capillary. Some arterioles are open ended here, and some arteriole is continuous with this sinusoid. Blood, when blood comes to this arteriole, they pass through these sinusoids, and finally they moves to the vein. This is the closed circulation of the blood within the spleen. And here is the open circulation. Here we see the blood vessel is ended here, so blood is left in this stroma of this spleen. This is known as the splenic cord. So blood is remain in this part, as like in the wide area, in the tissue, wide area of the tissue, the blood cells are dispersed, and this blood finally enter into this capillary through the spaces in between these cells. This cells is known as the stave cells. The stave cells has some spaces in between the cell. Through these spaces, the red cells can enter into the sinusoids. All red cells cannot enter through these pores, through these gaps. The red cells that has the flexibility, that can squeeze, they can enter through this pore. The red cell that is old, that has more fragile, that break down into this area, and macrophages clean these red cells. So one of the function of the spleen is to remove the old and fragile red cells. This is the process through which the old and fragile red cells are removed from this circulation. That is the open theory. When the red cells are poured in here, and the capable red cells that are flexible, that can enter into the sinusoids, and they finally enter into this circulation. And that are old, that cannot, old and fragile, that cannot enter through this pore of this capillary sinusoid, and they are distracted in this part of the red pulp of the spleen. And this red pulp has some macrophages. This macrophage clear off these red blood cells, and we know that red blood cell has hemoglobin, and there is iron, and this iron is finally delivered to the circulation for this recycling. Thank you all.